Mr. T.S. Singh Dio. Sir, there's a lot of talk right now about COVID. People are obviously right now scampering to find out, is there going to be another wave? Do you believe that, there's reason to panic and that, adequate steps are being taken to ensure we're fully prepared at least?
Certainly no cause for panic. We have had experience. We've had experience now of 4 waves. We were completely unprepared when the first wave hit us. And that was about 2 to 3 months after it was detected in China for the first time in the world. So we have time. We have time till it reaches our shores. If it reaches our shores, it has reached other countries. We hear of China, we hear of Korea, we hear of Singapore. We are talking about Germany and the US. So we are talking about spurts in all these countries. And these waves are to keep coming. We are not going to be limited by the 3rd wave or the 4th wave or the 5th wave. The concept is of the nth wave. There will be a number of waves, there will be spurts, there will be peaks which may be high or low. So hopefully we will continue to have low peaks, and we must be prepared for that. We must test more, we must vaccinate more. People particularly coming in from outside into geographical areas, they should be tested. If they are showing the least signs, symptoms of either a cough, cold or fever, they should certainly be tested for corona. So to be careful and to avoid public places unmasked, particularly those who are immunocompromised, all such people, elderly, 60 plus, all such people must be very careful, more careful now, when they go out into open spaces, public spaces.
You've summed up some of the basic steps that everyone can take very, very well, Mr. Dio. Just stay on with us. I'd like to also introduce Mr. Brajesh Pathak, who is the Uttar Pradesh Deputy CM and also the Health Minister of the state. Pathak ji, आप पहले हमको ये बताइए कि आपकी सरकार in Uttar Pradesh, what is being done to be fully prepared to ensure that you can fight COVID if there is a rise in cases, sir?
जिस ढंग से दुनिया के दूसरे देशों में कोविड के फैलाव की विस्तार की सूचनाएं आ रही हैं, वहां पैनिक है, हाहाकार मचा हुआ है। भारत सरकार के स्तर पर भी बैठक हुई है और उत्तर प्रदेश सरकार ने भी विस्तृत समीक्षा बैठक की है। हम लोग आज बैठे थे और अभी हमने तत्काल सभी जनपद के मुख्य चिकित्सा अधिकारियों को, जिलाधिकारियों को एडवाइजरी जारी की है कि भीड़ भाड़ वाले इलाकों में सभी लोग मास्क पहन करके आएं और हैंड सैनिटाइजर का उपयोग करें, सामाजिक दूरी बनाए रखें। अभी यही हम लोगों ने निर्णय लिया है, लेकिन इसके साथ ही साथ सभी हॉस्पिटल्स में कोविड से निपटने के लिए जो इंतजामात पहले हम लोगों ने किए थे, जैसे ऑक्सीजन प्लांट्स लगाए थे, वेंटिलेटर्स का इंतजाम किया था, सभी को चुस्त दुरुस्त रखने के निर्देश आज हमने दिए हैं। इसके अलावा हमने जो कोविड का नया वेरिएंट आया है, उसके अलग से एक जांच है, उसको भी कराने के निर्देश दिए हैं। यदि कोई मरीज मिलता है तो वो अलग से जांच जीनोम की भी होगी।
Same question to also Mr. Nivas, who is the Andhra Pradesh Health Commissioner. Sir, in a state like Andhra Pradesh, there was one point in one of these waves, I remember the second wave particularly, when Andhra Pradesh did see a worrying spike in COVID cases. So right now, with things looking as it is across the world, what's being done by your state, sir, to ensure that you're fully prepared to fight COVID?
See, first, in terms of the bed strength, currently we have enhanced our bed strength to 34,743 oxygen beds are currently ready in all the hospitals. And also with respect to the oxygen supply, we have set up 170 PSA plants. And also in terms of ICU ventilators, also we have around 8,500 ICU beds are also ready to tackle any kind of COVID emergency. And apart from that, we have a robust testing facility. We have established 29 RT-PCR labs, and apart from that, to monitor any new variant of COVID, we have established a genome sequencing lab, and we are doing the testing of the positive samples continuously. And as per the Government of India's directive, which was given very recently, now we are testing all the samples which is turning positive. And currently there is no cause for alarm because our positivity rate is only 0.42%. And last 50 days we have tested close to around 30,000 samples where we got only around 130 positives in the last 50 days. So
okay.
The situation is of not any high alarm, but we have advised people to follow the COVID appropriate behavior, and we are alert, and we are taking all the necessary measures for
Right.
taking the preventive action.